Okay. Hello. Good morning. Yeah, it's still good morning. So this is leadership and management in midwifery. And so for the past weeks now, we've been considering theories in midwifery. And so today we want to also start, or we want to consider leadership theories and styles. So so we want to continue with leadership theories and styles. Okay. So definitely, like I explained to you, when it comes to management and leadership, especially within the healthcare system where we find ourselves as midwives or nurses. So definitely we say leadership, but then we have theories or people who have come up with theories, and then some styles or certain styles that a leader can adapt to help or to influence, be able to influence his or her people or the one that she is leading, whether you are in a formalized leadership or informal leadership. So you should be able to at least understand and also appreciate the different styles and then the theories where it will help you to be able to know exactly which direction you want to lead your people, or you want to lead your subordinates or your colleagues who are under your supervision. Okay, so we will start by defining leadership again. Already, as part of the introduction, we've looked at what leadership is about, but then we will still consider it now that we want to look at the various theories that has been proposed, and then the styles that makes up leadership. So we are starting by saying that leadership is the process of influencing people to willingly accomplish goals. So it is the ability to influence the behavior of others towards the achievement of a mutually established goals. So like I always say that there is some commonality or some keywords when we want to look at leadership. So we talk about influence. So your ability to have influence or to be able to influence your subordinates or especially people under you. And here the other key word here is willingly. So they're able to willingly follow your influence in order to accomplish goals or a vision or something that you have in mind. Okay. So the second one also says that leadership is the use of one's skills to influence others to perform to the best of their ability towards achievement of goals without the use of threat or violence. So definitely, we have why we are so specific, or this definition is so specific, has to do with the fact that some leadership, some form of leadership can be coercive or can be in a more autocratic way of leadership, or a forceful way of leadership, where the people under the person doesn't have their own will or doesn't have their own will, but it's more like they are being coerced or they are being influenced. And when we look at healthcare, in fact, it's one thing that can easily happen. Especially where the patient or your client see you as the one who has the authority in terms of knowledge, in terms of care, in terms of, for example, if you tell me I'm a client, I come to your hospital or I come to your facility, and if you tell me Madam, go and lie down, let me come and check your fetal heartbeat, or madam, this is the medicine you have to take. Unfortunately for me, it's like the client comes to the clinic and it's more like at your mercy, because she or he is coming to, like, I don't know how to put it, but is willing to that is go by whatever information, whatever influence you want to have over the person. So sometimes it's like I said, when they come, they are more at our mercy. So it's the more reason why we shouldn't use our position, or we should be mindful of our position as nurses or as midwives, so that we don't let it seem like the woman is at our mercy, and then we decide to coerce them or use force in terms of care. So as we are caring for them, it's like you don't have option. So that's why now we have, so these are the more reason why now the right of women, that is respectful maternal care. In fact, it's actually born out of all these, because it has gotten to a point where the mother who is coming to give birth feels like, no, yes, I have this midwives who I thought is going to help me, care for me, and then tell me what to do. But then, unfortunately, sometimes they do it with force. It's like, madam, you have to push. And well, sometimes these things is actually, debate comes in when it comes to these things, because, for example, this woman is not pushing, and you, the midwife, from the point where you are looking at the whole thing, you think if the woman too doesn't push within the next few minutes, like is not going to also help the baby who is coming out, that is the newborn who is coming out. So like I said, sometimes these things is a point of, when it comes that way, it actually comes to a point of debate or discussion to actually know what to do. But like I said, in our field, it's easy for us to use force, or it's easy for us to, in terms of us leading, it's easy for us to load it, or it's easy for us to not even allow the client the free will in her decision making, and also making choices for her care or her health. Okay, so let's look at some characteristics of nursing leadership, and then the role and activities, that is the activities. So we look at the activities in a more of example, that is example to rate. So we are saying that leadership establishes direction. So definitely for a leader, there should be, you should be able to be someone who can establish direction. So there should be a clear direction. So one of the characteristics is of nursing leadership is establishment of clear, or establishment of direction. So here under the activities or the role, we are saying that nurses set personal, professional, and patient care goals. So it's not only for the patient care goals, but also personal goals and also professional goals. So for example, for the personal goals can be like you being at work on time, and also like if you are the type that maybe clients have been complaining about your attitude, then you know that you need to set a personal goal where at least you know that within a certain period you have been able to change in terms of your attitude, and then also professional, and then we have the patient care goals. Then number 2 says that leadership aligns people through empowerment. So definitely, so nurses demonstrate leadership when they model high quality practices as they work to empower and mentor other nurses. So your leadership should be able to align people through empowerment. So if you are not empowering anybody, then unfortunately you should question your leadership. You should question your leadership, because for example, if you are a leader and then maybe you are the DMS, or you are the nurse manager, or maybe you are the chief nursing officer there, and then all your subordinates, for instance, these young ones coming, if they are not, especially we now have this evidence-based practice, we now have in terms of continual education, and those under you are not even learning any new skill. They are not being empowered to even have high standards for themselves. Then you should question your leadership. Then the next one says that leadership motivates and inspires others toward achieving a vision and creating meaningful change. So they motivate one and inspires others toward achieving a vision and creating meaningful change. So with this, we are saying that nurses motivate members of the interprofessional healthcare team toward the delivery of safe, evidence-based, patient-centered, high-quality care. The next one says that leadership is about service. Yes, leadership is about service, and definitely one of the styles, the leadership styles that we will look at, is about servanthood. So we are saying that leadership is about service. So with each role, we are saying that leadership is helping others or doing work for others. So the profession of nursing is founded on serving others in need of health care. So leadership is serving others through leading. This concept has been popularized as servant leadership. Like I said, servant leadership. So the premise is that servant leaders want to serve first, whereas other leaders lead first. So for the servant leadership, they want to serve first, so that as you see me doing, definitely you also want to do same. Then the next one says that leadership is about people and relationships. So nurses demonstrate leadership and play roles in patient outcomes when they build relationships with patients and their significant others. That is according to Wang and Cummins 207. Then we are saying that the next characteristic say that leadership is contextual. So what do we mean by leadership is contextual? So nurses demonstrate leadership when they adjust their leadership styles to achieve nursing goals. So a major context evolves around the interrelationships the nurses have with others. So definitely it's contextual. Like I said, we will look at the styles, and what we will come to realize is that not only one style fits it all. So sometimes within the healthcare system or within the maternal unit that you find yourself, definitely you can adopt various styles at various points in time. We have obstetric emergency care, so knowing how to coordinate activities when it comes to emergency, and then when it comes to the routine care, for instance at the antenatal clinic, how as a leader, how do you help run if the antenatal care, that is which is a routine care for the pregnant woman at the various stages at every point in time. So we are saying that leadership is contextual. So that's why if you're a leader, you need to be flexible, because no one style fits it all. Then we are also saying that leadership is about using communication that inspires others. And I think it's very clear when it comes to communication and then the role it plays in leadership. So here with the role says that nurses demonstrate leadership when they monitor the meaning of what is being communicated, both verbally and non-verbally, and manage the situation to achieve goals for all involved, using communication that is clear and inspiring. So leadership is about balancing. Nurses demonstrate leadership when they multitask and balance all that they do to achieve nursing goals. Leadership is also about pursuing a work and life balance in order to sustain one's personal and professional self and be available for others. Leadership is the next one, says that leadership is about continuous learning and improvement. So nurses demonstrate leadership by developing personal and professional goals and continuing to grow their knowledge and expertise. The next one says that leadership is about effective decision making. So nurses demonstrate leadership when they make effective, evidence-based decisions. Nurses must be autonomous in their decision making, yet also work with other healthcare team members to ensure the best of care for their client or patient. So definitely, like even when it comes to maternal care, that is midwifery, it makes it more autonomous, because midwives are also prescribers, because we as far as the role we play in maternal care is concerned, definitely you should. So that's why you need continuous learning to help you improve in yourself and to give a better care to your client, and also in terms of making effective decision making. So we will look at that one in detail as we go along. Okay, then we are saying that leadership is a political process, and with the role or with the activity that a nurse or a midwife can play with it. Here we are saying that nurses demonstrate leadership when they participate in the hospital and in the community, join hospital and community boards of directors, and participate in various political processes locally and then globally. So that's why we also encourage our midwives and our nurses through research. So for you to contribute effectively, you need to be somebody who also like research or who is interested in doing research. Then the next one is that leadership is about integrity. So nurses demonstrate leadership when they consistently model integrity, honesty, fairness, and morality. Okay, so let's go straight to look at the theories of leadership. So like I said, we will look at the various writers who have attempted to theorize that is leadership, so that we'll be able to know which one we can model after for our effective leadership in whatever area, whether it being at the chiefs, you find yourself at the chiefs or a health center, or even if it's a clinic or a maternity home, or at the district level, at the polyclinic, or even at the regional hospitals. Okay, so we are seeing that various writers have attempted to explain the theoretical basis for leaders and then leadership. The first one we want to consider is trait theory, or what normally we call the great man theory. I know in some textbooks when you are reading, they separate the two, but both their idea is almost the same, or they are the same. So this theory identifies personal characteristics which a leader should have. So the theory states that leaders possesses a set of physical and emotional characteristics that are important for inspiring others towards a common goal. So this has to do with more of the personality of the individual. So some theories who subscribe to this theory believe that leaders are born with certain qualities that determine leadership ability and success. These leaders are seen as gifted or develop certain characteristics including body physique, in terms of their weight, strong muscular height, and definitely, with this trait and great man's theory, it's not that it's been eroded entirely, because definitely, this body physique, how it influence even with the physique alone. I remember, well, I know most of you, I don't know whether you've read about the story of how when Saul, the first king in Israel, when he was anointed as king. In fact, the Bible says that when he stood, when he went to the place where the Israelites were gathered, and when he stood, in fact, he was taller than all of them. He was taller than all of them. And I think in terms of weight and all that, so, definitely. And the moment they saw him or they recognized him, they were pleased. They were pleased, so that, hey, people would know that we don't have, excuse me to say, we don't have a short man as our leader, but when people see our leader, he is tall, he is giant, and all that. Yes, so people hide in that. People are much comfortable when such people are their leaders or their leader, so that in fact it even brings something around them. It brings something around them. So, like I said, this theory is not completely eroded. It's still in force, though there are others that we will consider as well. The mental abilities. So apart from the body physique, the mental abilities, knowledgeable, good judgment, wisdom. So it's not about, so here, apart from the body physique, we also want to know that you have the mental abilities, because already we've mentioned that we've seen a lot that has to do with the characteristics of a leader. So if we are only seeing the body physique, and we are not seeing in terms of your mental capabilities or abilities, your wisdom, being able to make good judgment, then unfortunately, though the people admire your physique, but yet they wouldn't like you so much, because unfortunately you are not able to apply wisdom in decision making. You are not knowledgeable in certain areas. Then verbal ability, fluent in verbal communication. And definitely, these people, they most of the time make a good leaders. That is, they are able to become a good leader, because, most of the time leadership is also about your ability to communicate. And we've also seen it as part of the characteristics. And then we have personality. So personality in terms of your confidence. Are you confident, aggressive, outgoing, risk taker, or authoritarian? So that is it for trait or theory, or what we call the great man theory. Okay, so let's look at contingency approach. And if you remember, we've already looked at contingency also under management theory. So for the contingency approach, it's also another approach to leadership in contingency. That is contingency theory. Contingency theory actually acknowledges that factors in the environment influence outcomes such as much as leadership style, and that leader effectiveness is contingent upon or depends upon something other than the leader's behavior. So the premise is that different leader behavior patterns will be effective in different situations. So here all that is saying is that depending on the situation, so that's how I said initially, as I've made mention of it, that a leader should be flexible, so that you should be able to adapt to different styles depending on the situation happening around you. So with that contingency theory under leadership, we are considering Felder 1976. So Felder 1976, he was accredited with the development of the contingency model of leadership effectiveness. So according to Felder's theory of leadership effectiveness, he views the pattern of leader behavior as dependent upon the interaction of the personality of the leader and the needs of the situation. So upon your personality and then the needs of the situation. So for example, I know there are leaders, though they may be, for example, if we are to go back to look at the trait or the great man's theory, you know, sometimes what happens is that there may be leaders who are like, in terms of physique, he has everything or she has everything. But then when it comes to wisdom, knowledgeable in a certain situation, unfortunately, she is not. So when it comes to applying contingency theory, it means that that leader, unfortunately, may not be able to adapt to all situations because she is not knowledgeable in certain things. So unfortunately, she is not able to motivate, or she is not able to influence or inspire the people around her to actually work or resolve the situation, or able to deal or handle the situation. So the needs of the situation, or how favorable the situation is toward the leader, involves leader-member relationships, the degree of task structure, and the leader's position of power. So we will look at these three as we go along. Okay, so the first one is leader-member relations. So leader-member relations are the feelings and attitudes of followers regarding acceptance, trust, and credibility of the leader. So it's about the leader-member relations. It's actually about the feelings and attitudes of followers regarding the acceptance, trust, and credibility of the leader. So please don't forget that we are talking about the relationship. So in terms of relationship, we are saying that the leader-member relations are normally, when we talk about that, is how the followers especially feels, and then their attitudes toward or regarding, in relation to their acceptance of that leader, whether they trust the leader, and then the credibility of the leader. And here we look at them in two different ways. So here we see that a good leader or good leader-member relations exist when followers respect, trust, and have confidence in the leader. But then on the other hand, poor leader-member relations reflect distrust, and lack of confidence and respect and dissatisfaction with the leader by the followers. The next one is task structure, because I said the degree of the task, that is the degree of task structure. So we are looking at task structure. So task, like definitely task is more like the work we've been given or we've been tasked with. Okay. So we have seen that task structure refers to the degree to which work is defined with specific procedures, explicit directions, and goals. High task, so with that one too, we have two. So high task structure involves routine, predictable, clearly defined work tasks. So here in such a situation, as we are looking at contingency effectiveness, the point is the task that we've been given, the structure, is it clear? Is there a specific procedure that we can follow so that it will make the work, the task easy to do? So is there a clear direction or goals that we are aiming to achieve at the end of the day? So with high tax structure, it involves routine, predictable. So we are able to predict what are for instance, if we clean the mother's womb with wound, we clean the wound with normal saline, we know this is the at least this is what we are going to achieve, an effective or very clean wound healing. And then we also know that if we use methylated spirit, so we have we are clear about the tasks that we are doing. So we are saying that it's routine, involves routine, predictable, clearly defined work tasks. Then we have low tax structure, involves work that is not routine, it's not routine, it's not predictable, or it's not clearly defined, such as creative, artistic, or qualitative research activities. You know, for qualitative research activities, because you have to conduct interviews, in-depth interviews with a person, you have to be using your recorder, and then sometimes note-taking. So with the low tax, what happens is that is not the routine tax that we are always anticipating or we are always looking forward to, but it's a tax that is not routine, and then we are not predictable, or it's not clearly defined, and but also it's not clearly defined. So it involves tasks such as that involves creativity, that are artistic or qualitative research activities. So here the tasks involve you, the one doing it, being creative about it, and also artistic. So let me see if I can clearly give this example to help. So for example, you have maybe you have about five women in your ward, maybe in your labor ward, going through various stages in labor. So definitely when it's time for, maybe because we have the latent phase, the active phase, and the rest. So for example, if depending on how each woman is progressing, the labor is progressing. So sometimes you, the midwife, you need to be creative in terms of, okay, so if this person is not progressing well, I'm okay, it's not progressing well, what is the next thing to do? Anyway, maybe I'm sure that one goes more with the high tax, which is more predictable. For instance, it's predictable in the sense that I know that if the woman passed the timing of labor, goes past the active phase, then I know the next step is either induction or induction, or the next step is to call the doctor in to also make a decision on her delivery. But then maybe let me give, in terms of the low tax structure, maybe let me use for instance, for example, maybe you are delivering a woman and there's a tear. So depending on the tear, maybe the woman, you are anticipating a tear. So you have to be creative in terms of whether how you are going to manage with a episiotomy, so that the woman may not suffer so much tear, or may not suffer so much tear, and also give enough room for the baby to come out. And then in terms of also suturing it. So here it just involves a task that you've been given, but then it involves you to be creative or artistic, that is to be creative as far as that is our profession is concerned, in your approach of handling the situation. Then the last one, or the third one, has to do with position power. So position power is a degree of formal authority and influence associated with the leader. So we have high position power is favorable for the leader, and low position power is unfavorable. So it means that high position power is always favorable for the leader, because here the leader is able to use his power or use his leadership influence to be able to help with the work or the situation that she is being confronted with. Okay, while the low position power is unfavorable. Okay, so in summary, when it comes to Felder's theory, so when all dimensions, that is what I mean by all the dimension is the three items that we've just considered. So when all dimensions, that is the leader-member relations, the task structure and power position are high, the situation is favorable to the leader. So please take note. So when these dimensions are high, the situation is favorable to the leader. So when these dimensions are low, the situation is not favorable to the leader. So in both circumstances, Felder showed that a task-directed leader concerned with task accomplishment was effective. So when for a leader in circumstances, that is, so in all these circumstances, so whether the high, which always favors the leader, or whether the low, which is unfavorable for the leader. So what Felder is saying is that a task-directed leader, so a leader who is whose aim or the goal is to achieve the task, that is to successfully achieve or see that the work is done, is always concerned with task accomplishment. So for that leader, because for her desire or her goal is to make sure that the task has been accomplished, what happens is that he is concerned with the leader and able to, she's a person who also accomplishes his tasks, and he considers that person as effective, that is the leader as effective. When the range of favorableness is intermediate or moderate, a human relations leader concerned about people was not effective. So here, let me take my time to explain it. So when the range of favorableness, so we've talked about the fact that definitely when the situation is high, it favors the leader. But then when the situation is low, and we've seen that with all these three dimensions, that is the leader-member relations, the task structure, the power position, the position power, sorry. So what happens that in all these dimensions, we have a situation at a point where there is high and then low. So then in summary, we are saying that whenever is high, for instance, in terms of leader-members relations, when it's high, it favors the leader. It favors the leader because what happens is that then there is trust, there's respect for the leader, and then they have confidence, the subordinates have, or the followers, they have confidence in the leader. In the same way, when in terms of task structure, when there is in high task structure which involves routine, predictable, clearly defined work tasks, it helps the leader because already everything is clear. So the followers or her followers are able to work towards it. The same way for the position power. So high position power, we are saying that it's favorable for the leader, because with that the leader is able to exercise her influence over her followers. So here what it's saying is that when the range of favorableness, that is between the high and the low, the good and the poor. So when the range of favorableness is intermediate, for instance, so because we have the two extremes, then we are saying that intermediate, so which means that in between. So when the range of favorableness is intermediate or moderate, a human relations leader concerned about people was most effective. So please, I hope you have, so it makes it, because I believe that at that point it's like more of a balance. It's like more of a balance. It's neither high or low, so it's intermediate. Okay. Then these situations need, the next point says that these situations need a leader with interpersonal and human, that is, and relationship skills to foster group achievement. Felder's contingency theory is an approach that matches the organizational situation to the most favorable leadership style for that situation. So what here is all talking about is that the leadership style that the leader wants to adopt or adopt in a situation within the organization must be the most favorable one for that situation. So with that, we look at situational approach. So situational, sorry, I think there's a typo, kindly forgive me, and you can cancel the R. Okay, so situational leadership theory addresses the follower characteristics in relation to effective leader behavior. So situational leadership theory addresses the follower characteristics in relation to effective leader behavior. So with that, we are looking at Hesse and Bankart's situational theory. Hesse or Essay and Bankart's situational theory. So whereas Felder examines the situation, that is, so for Felder, his contingency, his theory concerning contingency is actually about the situation, examining the situation itself. But then Hesse and I think these typo errors, please, when you get it, just you can correct it for me. So Hesse and Blankard consider follower readiness as a factor in determining leadership style. So they use the words task behavior and relationship behavior. So for them, task behavior is used to identify behaviors focused on tasks, and then relationship behavior are used to identify behaviors focused on relationships. Okay, so I believe this one is clear. So further explanation to it says that high task behavior and low relationship behavior is called a telling leadership style. So a telling leadership style is when there is high task behavior and low relationship behavior. Yes, and low relationship behavior. Okay, and then a selling leadership style has to do with when there is high task behavior and then a high relationship style. Then we have participating leadership style is when we have a low task and high, that is a low task behavior and high relationship style. And then we have a delegating leadership style where we have a low tax behavior and then a low relationship style. Okay, so please just take note of that. Then the next one has to do with their readiness. So follower readiness, or follower readiness, also called maturity. So follower readiness, called maturity, is assessed to select one of the 4 leadership styles for a situation. So for example, according to Hesse and Blanchard's Situational Leadership Theory 2000, groups with low maturity, whose members are unable or unwilling to participate or are unsure, need a leader to use a telling leadership style to provide direction and close supervision. So here they have a low for the telling leadership style. So they have a high tax behavior, but then they have a low relationship. So for those with, so in terms of the follower readiness, one, they in terms of follower readiness, where we call it maturity. So when there is a low maturity, or when there is a group with low maturity, what happens is that they need a leadership style called the telling leadership style, which we've already looked at the explanation. So we've already looked at those who falls under those categories. So here we are saying that with groups with low maturity, whose members are unable to or unwilling to participate or are unsure. So here, unable or unwilling to participate or are unsure, need a leader to use a telling leadership style to provide direction and close supervision. So here, it's not that they don't want to do the tax, or it's not that they don't have a tax good, that is they have a high tax behavior, but then because of their relationship, so because of that, they are not willing, much as they can do the tax, or they have a high tax behavior, but then because in terms of readiness, they have this low maturity. Unfortunately, the leadership style has to be that of telling, so that the person or the leader should be able to give a clear direction, provide a clear direction, and also close supervision. Then let's look at the selling leadership style. The selling leadership style is a match for groups with low to moderate maturity, so who are initially unable to do the task, but willing and confident and need clear direction and supportive feedback to get the task done. Then we have the participating leadership style is recommended for groups with moderate to high maturity, who are able but unwilling to do a task or are unsure and who need support and encouragement. So the leader should use a delegating leadership style with groups of followers with high maturity, who are able to do a task and ready to participate and can engage in the task without direction or support. Okay. An additional aspect of situational leadership theory is the idea that the leader not only changes leadership style according to followers' needs, but also develops followers over time to increase their level of maturity. So in situational leadership style, it's not always about you maybe bowing to the needs of your followers, but your ability rather to develop them over the time to a point where they are able to mature or increasing their level of maturity. And with that, we can see that for that one, you just relax, or you are just playing a supervision role, because here what you are doing is that you just delegate the tasks, because they've come to a certain level where you can easily delegate tasks to them, and then they are willing to do it, and they also have high task behavior. So in summary, the use of these 4 leadership styles helps a nurse manager lead effectively and assign work to others. Sorry, this is supposed to be 2. The next theory, let's look at the path goal theory. Okay, so let's look at the path goal theory. So with the path goal theory, we are saying that the seminal author of path goal theory is Robert House, 1971. So in this leadership approach, the leader works to motivate followers and influence goal accomplishment by using the appropriate style of leadership for the situation. So for the situation. So by using the appropriate style of leadership for the situation, so that is in terms of directive, supportive, participative, or achievement oriented. So the leader makes the path toward the goal easier for the follower. So the directive style of leadership provides structure through direction and authority, with the leader focusing on the tasks and getting the job done. The supportive style of leadership is relationship-oriented, with the leader providing encouragement, interest, and attention. The participative leadership style means that the leader focuses on involving followers in the decision-making process. Then the next one says that the achievement-oriented style provides high structure and direction, as well as high support through consideration behavior. So the leadership style is matched to the situational characteristics of the followers, so such as the desire for authority, the extent to which the control of goal achievement is internal or external, and the ability of the follower to be involved. So here the leadership style, whether participative, supportive, directive, or achievement-oriented style. So here all that is saying is that leadership style, so choosing any of the leadership style that you think works well, will work well within your leadership, is matched to the situational characteristics of the followers. So such as their desire for authority, that is the desire for authority, the extent to which the control of goal achievement is internal or external, and the ability of the follower to be involved. Okay, so the leadership style is also matched to the situational factors in the environment. So apart from the situational characteristics of the followers, the leader also has to match her leadership style with the situational factors within the environment where she finds herself. And this includes the routine nature or complexity of the tasks, the power associated with the leader's position, and the work group relationship. So this alignment of leadership style with the needs of followers is motivating and believed to enhance performance and satisfaction. So for the path goal theory, so as I've explained, it's actually an approach that actually where the leader works to motivate. So it's about motivating followers and influence goal accomplishment. So your ability to motivate followers and influence goal accomplishment. So these 4 leadership styles can be adopted depending on the situation. So if you are a leader and where you find yourself, are you going for directive style? Are you going for supportive style, or participative style, or achievement-oriented style? Okay, and then we've also seen that matching these styles also has to do with the situational characteristics of the followers and also the situational factors within the environment where you find yourself. So this alignment of leadership style with the needs of followers is motivating, and like I said, definitely will enhance performance and satisfaction. So in summary, the path goal theory is based on expectancy theory, which holds that people are motivated when they believe they are able to carry out the work, think their contribution will lead to the expected outcome, and believe that the rewards for their efforts are valued and meaningful. Okay, so here, this is just something to think about. So several characteristics attributed to leaders include caring and the rest. So review. So here, what to think about says review each of these characteristics attributed to leaders. Are these the characteristics you think are important for next leaders? To what extent do you portray each of these leadership characteristics? So this is something for you to also think about, and then reflect on your leadership style so that you can make the appropriate adjustments, or yes, you can make the appropriate adjustment or change to help you be effective in your leadership. Okay, so let's quickly look at contemporary approach. So for the contemporary approach, we have contemporary leadership, that is approaches to leadership, addresses the leadership functions necessary to develop learning organizations. Okay, so with that contemporary approach, we actually want to look at the various leadership styles. So we have the autocratic, we have the authoritarian, or what we also refer to as dictatorship leadership. Then we have democratic or participative. We have the laissez-faire or the permissive, that is permissive or the carefree type of leadership. We have the transactional leadership style. We have the transformational leadership style. We have servant leadership style, bureaucratic leadership style, charismatic leadership style. Then we have what we call the coaching leadership style. Okay, so let's see how far we can go. All right, so with authoritarian or autocratic leadership, so we are saying that this is the style where the leader assumes full responsibility for all decisions and actions. Characteristics of an autocratic leader include the person is task-oriented, gives direct, clear, and exact orders to his employees with detailed instructions as to what is to be done and how, leaving no or little room for employee initiative. So the person delegates or she delegates as little as possible and believes that she can do a better job than his followers, has little or no confidence in workers, functions with high concern for task accomplishment, but low concern for the people who perform these tasks, frequently exercises power, sometimes with coercion, and is firm, dominating, and insistent. So these are characteristics of somebody that we can refer to as an autocratic or authoritarian leadership or leader. So let's look at the pros and the cons, or the advantages and disadvantages, because definitely, like I said, that no one leadership style fits all. So you can adopt as many, that is, learn to adopt as many as you can, so that it will help you in different situations, or depending on the situation where you find yourself. So some forms of, so with the advantages, we are saying that some forms of authoritarian leadership are applicable to healthcare. It is particularly suitable in crisis situations. So, or in emergency, when there's an emergency, there's an outbreak or something. So, it's suitable in crisis or emergency situations when clear directions are of highest priority. So that is, it is the only way to get action done in an emergency. Action first. So no time to question, orders must be issued. So it may also apply in situations where the people being led are inexperienced. So it means that you need to dictate things for them so that they can be effective. Okay. Then we have disadvantages. So we look at the disadvantages by saying that the workers only work when leader is present, but in his absence, they spend time trying to undermine him at the expense of working. And unfortunately, you know, this even do more harm than good, because like here, like the explanation goes, definitely, you know, anytime the leader is not there, rather than they spending time to work, unfortunately, the work will be there. In fact, they sometimes, the funny aspect is that, you know, they rather there's some form of displacement, because they know that definitely they can't talk back, or they can't say anything negative that is when the leader is present. So what happens is that when the leader is not there, that's their only chance, and unfortunately the subordinates or the followers want to do whatever they want, and unfortunately, in fact, it sometimes can be bad, and if the care is not taken to, they displace those anger or whatever sentiment they have on the client. So the leader is not the sufferer, but unfortunately there's a displacement on the client who has innocently come for care or come to be taken care of. Okay. And also they also spend time, and also it's a place where gossip never passes, because unfortunately they have to, rather than working, because when the leader is there, they know that it's time for work, no time for communication. So the moment the least of chance, then that's the time they will also want to rest, and they will also want to communicate, gossip among themselves. Okay, so enough of that. Let's go to the next one. It may cause employees to lose interest and initiative and stop thinking for themselves, because there is no need for independent thought. Also, it may also lead to a loss of motivation, especially where employees find it necessary to adopt an attitude of obedience to the autocratic boss due to lack of that is the next one. Say that due to lack of motivation, the employees may reluctantly give only minimum performance. Then the last one says that as a result, less than optimal goals are achieved because the resources utilized are those of the manager only. Let's look at the democratic leadership, or the participative or consultative leader. Okay, so the democratic leadership refers to a situation where people are free to express themselves. The manager encourages subordinates to give views, opinions, and suggestions during planning, organizing and decision making through discussions or dialogue at various levels. So a collaborative spirit for joint effort exists, which allows for group participation in decision making. So here the leader assumes that employees are eager to perform their jobs and capable of doing so. So here it also helps you, like we've learned about the path goal, and we've also learned about the fielders contingency approach. So you can, all these comes to play, because definitely once you assume or you know that your employees are eager to perform their jobs and capable of doing so, then you know which one, whether is it about the delegation approach, or is it about the style, or is it about that is about any of the approach or the style that you want to, in terms of direction, or any of the style you want to use. So the group is seen as having responsibility for goal determination and achievement. Democratic leadership encourages enthusiasm, high morale, and increased satisfaction. So we have the advantages and then the disadvantages. So with the advantages, we say that it leads to cooperation spirit in work performance, enables collective ownership of decisions, successes, and failures. So definitely when there is a failure, they all accept it. Oh, definitely, maybe we could have all done it this way. And in the same way, when there are successes, definitely they believe that collectively they've achieved that. Then research has shown that this style of leadership leads to high productivity and is the most desirable form in a wide variety of work situations. With the disadvantages, we are saying that discussion cause delay, time wasting because of disagreements, postponement, not able to come to agreement, and it can drag on and on and on. Let's come to the third one, the laissez-faire or the free reign or permissive leadership style. So in this style, the leaders let people do what they want. This is where there is no guidance by the leader. The workers work as they wish, with or without achieving the objectives. The leader is also preoccupied with his own work and never communicates with subordinates. Too much discretion, which leading to freedom. So the leader plays down his or her role in the group's activity and exercises minimum direction or control. The leader wants everyone to feel good about what they are doing and often avoids responsibility by relinquishing power to followers and permitting them to engage in managerial activities. For example, decision making, planning, setting goals, structuring and controlling the organization. So with that we are saying that we have the pros and the cons. So the style is evident when a manager is too weak or feels threatened to exercise the function of leadership. Then it is also visible when the manager has a great need for approval and does not want to offend anybody. In this case, the following can be observed. So little or no visible leadership. So you can see that the job is there. So everybody comes in, and then the only thing you will see a leader, or yes, you will see a leader there is when you are applying for the job. You know that at least you pass through somebody. But then as to whatever happens, the rest is your own. The manager tends to be preoccupied with his own work. There is no communication and direction to the employee. There is very little teamwork, and employees do as they wish. So with the disadvantage, we are saying that this type of leadership can lead to organization collapse. Okay, so you can add to the advantages and then the disadvantages as well. Let's look at the bureaucratic leadership style. So bureaucratic leaders live by the rules. Already, we've looked at a similar, that is with the management theory. So there are certain times that you expect to get things done by the book. That is legal means, that is, it follows everything legally. So likewise, you want to lead your team by the laws of the book. So bureaucratic leaders always follow specific rules and stick to those at all times. Yet, this leadership style can be very rigid at times. This rigidity restricts the leader, the level of creativity in the process. So key characteristics of bureaucratic leadership style. So we are saying that a bureaucratic leader loves rules, policies, and follows procedures meticulously. Decision-making processes are typically slow-paced. There is no room for new ideas or innovations. A management approach of this sort is also very well organized, yes, because for them, they are following it to Tito, like everything has to be duly followed. So leaders here delegate the tasks as per ranks for better results and accountability. Let's look at the advantages and disadvantages. So with the advantages, rigid leadership style. So it does not encourage change and improvisation. So you can't improvise. Best suited for large manufacturing organizations. Quick completion of tasks, it is predictable. Then with the disadvantages, we are saying that no room for creativity, lack of competition, difficult to adapt to change, must follow and go by the rules, slow personal growth and development. We are going to look at number 5, transformational leadership style. So this leadership style believes in the concept of transforming anything into something better. Transformational leaders provide the team members opportunities to explore different ideas and approaches. You make your team feel that you care about them by putting them first. So you express care and concern for your team members and their problems. So it fosters a sense of bond. It fosters a sense of bonding, belonging, and loyalty towards the organization. So key characteristics of transformational leadership style. So we are saying that it works best when you need fresh ideas or new perspectives. There is also a particular appetite for risks in this leadership style. It is because leaders are always on the lookout for better ways. It means going out of one's comfort zone. Okay, so this style encourages both the professional and personal growth of the employees. Let's look at the advantages and then the disadvantages. It gives a lot of freedom to the team members. It encourages creativity. It breaks monotony. It encourages learning and development. It encourages change. Then with the disadvantages, we are saying that too much focus on the bigger picture. Regular feedback is essential. Too much freedom can also be risky. So not always detail oriented. It can result in employee burnout because always they are involved or engaged in one way or the other. Then transactional leadership style. Transactional leadership style is a give and take scenario. So reward or penalizes your employees according to the organization's standards. Everyone knows what to do, why to do it, and to what standard. So evaluation of employee performance happens with predefined criteria and goals. And I think in most of our work we do. So evaluation of performance, already the forms are there. So you are evaluated at certain point in time to actually let your leaders or your managers know your performance. So this style can be effective if the employees are also motivated by perks and benefits. So it works best where the tasks are repetitive and goal-oriented. So key characteristics of transactional leadership style. So it focuses on concise goal setting and communicating clear expectations to the employees. The employees need to be equally motivated by getting the proper amount of rewards and recognition. Ideal for large corporations with global teams. Transactional leaders prefer typical workflow and satisfy the daily quota. Okay. So the advantages and disadvantages. So favorable in crisis management, achievable short-term goals, clear structure, systematic and easy to understand, sense of fairness. Because definitely when you do good, we reward you. In the same way, if you don't do well, or you do something that goes against the policies of the organization, definitely you also face the penalties or the consequences. So with the disadvantages, we are seeing a motivation only through rewards, lack of focus on building relationships, discourage innovation and creativity, lacks long-term goals, no scope of further development. Let's look at the servant relationship. And then I also added emotional intelligence, which I believe we can quickly also look at that. Okay, so servant leadership style. So the servant leaders operate on the idea of service first, leader later. That is service first, lead later. This style of leadership runs on the motto, you manage other people the way you would like to manage. So you ensure that everyone knows their job. Ensure that they have all the tools and supplies they need before they begin. If they don't, you offer them everything they need to succeed. So this style is a favorite among the workers. It works wonders for employee morale and employee experience. So definitely, if we get, definitely when you are at work being the leader, your subordinates or your followers will not, your subordinates will not sit there for you to be doing the dusting, for you to be doing the mopping and the rest. But then, for example, if there is dusting, or if water has poured on the floor, or maybe there's dusting to be done, maybe your workers are always willing, especially when they are able to get hold of, for instance, if there are dusters to be used, Savlon to be added, water running. So you are there to help in a more sure way by providing them with the necessary help or with the necessary gadget to work with. So this style is a favorite, like I said, it's a favorite among the workers. It works wonders for employee morale and employee experience. So with the characteristics of servant leadership style, This style has a high degree of awareness toward the team. Leaders of this category are great listeners. It gives them a better understanding of the team's strength and weakness. Great for building trust, respect, and loyalty. Helpful in building a solid company culture. So let's look at the advantages and then the disadvantages. So it promotes ownership and responsibility. It increases employee morale and confidence. It builds trust within the team. Team members feel valued. Leaders consider and prioritize employees' opinion. Then with the disadvantages, we are saying that several leaders can be perceived as incompetent sometimes. It can sometimes create confusion, slow decision making. Team members might not be competent to take decisions. Leaders lose their authority because sometimes, especially if you get people who don't respect, naturally it's like they don't respect authority. So if you bring yourself that low, they think that, it's because you don't even value yourself, or it's because, maybe you are equal with them, but maybe they may not know why you are doing that. Yeah, so like I said, no one style is perfect. So you have to adapt the style depending on the situation you find yourself in. So quickly, let's see and then look at emotional intelligence. So emotional intelligence is something that is very important that we consider in our work for us to be effective leaders. So we are saying that emotional intelligence, what is it? Is the ability to identify and manage your emotions. Incorporate the ability to identify and name your emotions. Then ability to harness those emotions and apply them to tasks. Then ability to regulate your own emotions and help others do same. So one, the ability to identify and manage your emotions. I've over the times, especially when I was working at the clinical field, and it's still there, the public perception about nurses, the attitude of nurses and midwives. And even sometimes you yourself being a colleague, and then you look at the attitude of others. But in the eyes of the public, they think every nurse, every midwife, their attitude are the same. So what happens is that you should be able to learn your emotions, and also you should know yourself. So emotional intelligence is your ability to know yourself and also know where the work or the profession you've chosen, and then being able to manage it. And then secondly, incorporate the ability to identify and name your emotions. So we have the various temperaments, which also goes with emotions. And you should be able to know how to handle it. Then ability to harness those emotions and apply them to tasks. So if you are the type who is always aggressive type, then you should know how to also apply it to tasks. Then ability to regulate your own emotions and help others do the same. So one, your ability to identify and manage them, and then your ability to identify and then name them. So you name them. And then your ability to harness those emotions and apply them to tasks. and then maybe you are the type who is like very calm, and then you're able to talk to clients, especially when they lose their newborns. So you harness that emotions and you are able to apply them to tasks. Also, your ability to regulate your own emotions and help others do the same. So as a leader, you need to know this so that you cannot, after you've been able to manage, identify yourself, manage everything, then it will help you to also help others manage theirs. So let's look at principles of emotional intelligence. So we have self-awareness. So there are 5 in all. We have self-awareness, so aware of your moods and emotions. We have self-regulation, manage your moods and emotions. We have motivation, see tasks through despite your emotions. Then empathy, recognize other people's emotions and understand their perspective. Then we have the social skills, which says that develop trust and build rapport with others. So qualities of an emotionally intelligent person. So we've already said it. So self-awareness, social awareness, relationship management, and then self-management. So the self-awareness, emotional self-awareness, accurate self-assessment, then self-confidence. So for you to be an effective leader, you need to be able to assess yourself, be self-aware, who am I, and then to be able to actually build on whatever deficit you may have as far as your emotions are concerned. And I believe that as nurses and midwives, if you are able to manage that, honestly, it will bring life to the patients, our clients that we care about. I talked, as I started initially, I talked about respectful maternal care. In fact, it was all born out of this kind of attitude of healthcare professionals, especially within our maternal, that is our maternity care towards our clients. So let's be self-aware so that we can be effective leaders towards ourselves, even our own colleagues, the work, and also towards our clients that we are taking care of. Then we have social awareness, so empathy, organizational awareness, service orientation, and relationship management, developing others, inspiration or inspiring. Then conflict management. We will look at conflict management as a whole topic. Then we have self-management, managing your emotions, self-control, initiative, and then being optimistic. So developing, how can one develop emotional intelligence? Actually, this one is a video, but unfortunately, I won't be able to play it. Okay. So developing emotional intelligence. So I think with all this, how do you become self-aware? So we have what we call mindfulness. So be present in the moment. I know, for example, for you as CODeL students, definitely you are mothers. Most of you are mothers, or you are family women, you have children, you have your husband to take care of. Then you are working as well. Some may have to go for nights and all that. But then you also need to continue your education to upgrade your knowledge. So the point is, sometimes either you tend to take whatever is happening, some challenges you are facing at home, to work, and then in a way affecting the clients that you are taking care of. Or what also the other way is that maybe at work and then lecture time is on. So how do you then juggle? So the point is, you then take whatever challenge at workplace, either you send it home, or either now when you come to online for lectures, it's like now it's a whole noise making and it's a whole lot of things, and at the end of the day you may not even benefit from the lecture. So be present in the moment. Wherever you find yourself, be present. Make sure you are there. It's not that, what I mean you are there is that it's not that you are present. Okay, as for, because I want to be marked up present, so you are there, but your mind is somewhere else. So keep a journal. So write about and analyze the emotions you feel. So sometimes, depending on how your emotions are overwhelming you, so this is all part of your self-awareness. So this is also an activity you can also do on your own. So you can keep a journal to write about and analyze the emotions you feel. Then self-regulation, how do you develop that? So understand the triggers that make you angry. Utilize deep breathing techniques. Pause before responding in a conversation, email, or text. Then take responsibility for your actions and behavior. Then we have motivation. So develop self-discipline. Set short-term and long-term goals. I know as for this, most people, especially setting goals, well, let's go with the flow. So for example, all my colleagues that I completed or I graduated school with, they are all going to do degree. Okay, let me also take my bag and apply to do this degree. But then, aside everything, you should have your goal. I remember what actually helps me was when I was doing my degree, there was this white lady, professor, who was in our school, who was our lecturer. And then I remember I wanted to travel at that time, use the student visa or student work permit to travel. And then I remember because I am going to her hometown or where she comes from, I just wanted her view. What's the place like? Because it was my first time. What should I anticipate and all that? Then I remember all that she asked me just one question. She said, what do you want for yourself in the next 5 years? Fine. If it's about traveling, fine. But then what do you want for yourself in the next 5 years? How do you want to look at yourself? How do you want to see yourself in the next 2 years, in the next 3 years, in the next 4 years, 5 years, 10 years? So you'll be there and all your mates will go on to do their PhD and all that, and you'll be there. Because everybody is now going to either UK, US, Canada, Australia, just to mention. So the point is, what do you want? Set goals. So that over there, are you going to live there forever? Are you going there with your family to live there forever? You will no longer return to your country. So you should have a goal. Look for and celebrate small wins. So definitely you have to look within and then celebrate small wins. For example, maybe they've made you a leader, they've made you the in charge. Maybe initially you may think, oh, I'm the quiet type, I'm the one who easily gets angry. So assess yourself, analyze yourself, and then also set, as you analyze yourself and then you put measures in place to help you develop a good character. The point is, it says that celebrate small wins. So if you were able to be nice to a client, even in the phase where, in fact, the tone where the client came to you wasn't even palatable, yet you were able to maintain your calm and was able to talk to her nicely. at least you've achieved something. Maybe if it's about conflict resolution, oh, maybe you've been able to help your colleagues or those your subordinates under you resolve a conflict so successfully. Celebrate those wins. That's what it's telling you. Then rediscover your purpose. Rediscover your purpose. So we have the empathy. Think about other viewpoints. So seek out opportunities to learn about other people's values and culture. So for your clients, so it's not, this world is not only about one person. It's not about you. So with your client, or because that client is not from the Ashanti, or the client is not from your tribe, or the client is not from within, like, in quotes, where you wanted to, maybe those groups that you want to take care of them, or in terms of socioeconomic status. So this is not from a high socioeconomic environment, and so maybe your emotions towards the person is different. So here is saying about developing empathy. So developing empathy says that seek out opportunities to learn about other people's culture and values. Then use active listening skills. Do not interrupt. Look at the non-verbal communication. Then we have the social skills. So with the social skills, we are saying that develop communication skills. So take a quiz to see what skills you need to improve. Embrace awkward or negative situations. Practice skills with friends and family. Develop trust and rapport with people. Then you build confidence. Okay. So test your emotional intelligence. So here to do that test, we have what you call navigate, evaluate, click, and then review. So navigate to the quiz. So how emotionally intelligent are you? Maybe I will get that quiz for you so that you can assess yourself. Then evaluate each statement. Review each statement as you are right now. Okay, so I'll do that and then send it so that you can actually assess yourself. Okay, so developing emotional intelligence is imperative to success, definitely. To be a successful leader, you need, or an effective leader, you need to develop emotional intelligence. There are 5 principles of emotional intelligence. So I think we've already looked at that. The self-awareness, self-regulation, motivation, empathy, social skills. Okay, also always look for ways to develop your emotional intelligence. Okay, so these are so for example, so emotional intelligence and social competences, then examples for a beginning nurse or leader. So we talked about self-awareness, so knowing what you are feeling in the moment and using your preferences to guide your decision making, having a realistic assessment of your own abilities, and a well-grounded sense of self-confidence. So for example, recognizing fatigue and feeling a bit drained after admitting a new patient and getting another patient off to surgery, rather than skipping a break, thinking that the break time will help with catching up. So the emotional intelligent nurse uses self-awareness to decide it would be best to take the break. So she checks in with the charge, that is the in-charge nurse or midwife, and then hands off assigned patients and uses the time to rest and refresh. So definitely you need to refresh and then you need to rest. So with the self-awareness, like you know yourself, the time you think, no, this time I'm too tired, and you can just step aside and rest for a while whilst you allow others to take over. Then self-regulation, so handling your emotions so that they facilitate rather than interfere with the task at hand. So being conscientious and delaying gratification to pursue goals and recovering well from emotional distress. So then we have motivation, using your deepest preferences to move and guide you toward your goals, to help you take initiative and strive to improve and to persevere in the face of setbacks and frustrations. In terms of empathy, sensing what people are feeling, being able to take their perspective, cultivating rapport, and being in tune with a broad diversity of people. Then in terms of social skills, handling emotions in relationships well, and accurately reading social situations and networks, interacting smoothly, using these social skills to persuade, lead, negotiate, and settle disputes, and for cooperation and teamwork. So in all these, you need to know where, as a midwife or as a nurse, where you fit in, and then where you can easily handle when it comes to such situations. So please, we need to actually develop these skills, which is good for effective leadership. Okay, so thank you so much, and then I hope to see you soon. The next time we meet, we will just I will just welcome questions, and then hopefully we move on to look at functions or activities of management. So thank you all, and I wish you all the best. Bye.